All right, good day everyone. So we will now have module 12. This is the last module of our lecture. So we will be discussing chapter 40, which is using heat and cold. It's very important also that we apply the cold and hot compress. That's what the other term of these all about. So again, it has been used for many centuries already in the healthcare setting or even like in a home setting to treat illness and injuries, like if the client has an infection, if the fever is too high, if there might be some muscle aches, swollen muscles or whatnot, and those things, right? Again, as what I have said, it's applied by nurses, by physicians, or even physiotherapists, right? So it actually promotes comfort for the client. It also helps in terms of healing and swelling reduction. So it's more on like a muscle swollenness and pain and all that stuff, right? So it's always good that we know how to apply heat and cold compress. Some of PSWs also actually allowed to do this. I'm not sure if now you need to undergo certain training just to apply, but there are things that we will learn here in this chapter on what are things to watch out for when you're doing such heat and cold compress. Okay? So first, let's have the heat application. When we talk about heat application, it actually relieves the pain and muscle tension of the client. Okay, so if the client has muscle tension or it might be very swollen because of like over fatigue, over exercise or whatnot, or maybe there's no proper circulation, there might be a muscle tension that will build, right? So and if there's a muscle tension, there might be pain. So heat application is also good to relieve that. Okay. Also increase blood flow and oxygen delivery, as what I've told you in terms of circulation. It's always good for clients who are bedridden, for clients who are have minimal movements or mobility. Heat application also could be a good effect to it. It also decreases joint stiffness and promotes tissue healing. Okay, so in every time when there is a heat application, vasodilation is number one effect of heat application. And the vasodilation, it's one thing that great for healing in terms of stiffness, tensions, and pains, right? So that's why it's still applicable for clients, even nowadays, the hot compress or heat application. So for the safety of the client of enforce for your safety so that you will not commit a mistake, always remember that heat application or hot compress can still cause burns, right? So very high temperatures can cause burns, so you need to be very careful and always double check if it's good enough for the client, right? You can touch it from your own, like putting the hot compress to your skin. If it's too hot for you, then that means it's too hot to for the client. And make sure you check the skin integrity or the skin every 5 minutes when you're doing the compress. And make sure that you will not apply the hot compress longer than 15 minutes. It should be cut. You can do it every 5 minutes and then remove it and relax for a while and then put it again and then another 5 minutes and then at last 5 minutes, right? So you can do that. So for clients who are actually high risk, like they have like skin issues or maybe their skin is so fragile and vulnerable, make sure that you need extra caution. If you're not doing anything, it would be advisable that stay with them in the room just to make sure that you are checking their skin regularly, right? We don't want to have burns. That's a big no-no. So that's why we need to have those preventions and monitoring responsibilities as much as we could, right? So that's the safety part. Next will be cold application or the cold compress. Okay? So for cold compress, it actually used for their client if we have client who got into sprains because maybe they fell or they walk in an imbalanced way. There might be some fractures or acute injuries, right? So those are cold application is perfect for that. Same thing in terms of the effect, it helps with swelling, it helps with reducing the pain, and of course the bleeding as well. So if the client is bleeding, it's always good to have the cold compress rather than a heat application. Okay? Because in a cold compress it constricts the blood. It's not vaso. Okay? So it limits the inflammation of the area or the affected area. So usually cold compress, it's always best for an immediate, what they call this, I'm thinking about the term, mm, immediate respond after an injury, right? So it's instead hot compress, do the cold compress first before you do the heat application later on, right? So cold compress is always the best immediate response for any injuries, right? So always remember that one. It's a first aid, yeah, first aid. It's part of the first aid procedures. So what are the complications when we apply cold compress? Of course, it is a risk for frostbite. Remember, during winter too, we need to cover our body, our skin with everything that we can cover because we don't want to get a frostbite, right? So same thing with cold application. Make sure that you need to watch out for frostbite. It could lead to blisters, pain, and burns too, because if it's too cold, it can burn the skin as well. So make sure you need to always double check as much as possible. Not too cold, it's just right temperature. Again, you can always check on your own skin before applying it to the client. So when you are putting the cold compress into a prolonged situations, it could actually rebound to vasodilation. So it's always good that you need to put in just a certain minutes, right? You don't need to put the cold compress in a longer times. Okay? Skin must always be checked frequently also. So again, for both heat and cold compress, make sure you always follow what's in the client's care plan. That's always ideal. I've been telling that all the time. You need to follow the client's care plan if they allowed for hot and cold compress. Support workers, of course, it's needed by, and also it says it's needed by a nurse delegation. So you can't just do it on your own. It needs a delegation from the nurse, instruction from the nurse that you are allowed to do so. Okay, and then you need to monitor the responses or the effects of the cold compress or the heat compress continuously, and then use rice for recent injuries. Okay, so what do you mean by rice for recent injury? Anyone? So again, rice means you need to rest, ice compression, and then elevation. So it is always a standard first aid protocol used for the first 48 to 72 hours to treat acute soft tissue injuries like sprains, strains, and contusions, right? It actually helps in terms of reducing the pain, the swelling, and inflammation. Again, rice means, or the rice method means rest, ice, compression, and elevation. Okay? So always follow that one in terms of applying heat and cold safety measures. If you want to learn more further about chapter 40, it's a heat and cold application. It's always in the it's always in the PSW Foundation Elsevier 2022. Okay? So that's it for today. I'll see you again in the next chapter.